It is now 12 months since I had the operation, and before I had the operation I had a PSA level of 6.1. Since the operation I've had 3 blood tests, 3 PSA blood tests. They all indicate undetectable PSA levels. Okay. Before I was diagnosed with the prostate cancer, I had done a great deal of research into the various treatments. And so when I was advised that I had clearly had prostate cancer, I then had to make a decision about which treatment I was to undergo. I discussed that with my urologist, Dr Hodo Haxhimolla, and he gave me the various, reiterated the various options available to me and discussed the pros and cons of each one. The options given to me by Dr Haxhimolla, and which I had read about, were high intensity focused ultrasound, low dose radiation, high dose radiation, external beam radiation, the normal surgical procedure, and keyhole surgery. One of the options available to me was watchful waiting, which is active surveillance, and Dr Haxhimolla advised me that because of my relatively young age and my fitness level, that this was probably not a viable option because the cancer was likely to increase in time, over time, and I became very uncomfortable with that prospect, and so I decided on the laparoscopy strategy. The reason I chose the laparoscopy technique was mainly because, from my understanding and from my discussions with Dr Haxhimolla, that there was a far better outcome for the patient in terms of less time in hospital, better recovery rate, and that some of the other procedures, if they fail, there was particularly the radiation strategies, if they fail, then there is no hope for surgery. After the operation I was in hospital for only 3 days, and then I returned to home, and I had a nurse coming in to see me each day for the wounds for about a week or so. The incontinence, my continence returned after about 6 weeks very well. After my leaving hospital, after the 3 days in hospital, I was able to move quite freely around the house, relatively freely, and within 6 weeks I was back in the gym.